Thank you, Mr. Chairman, and thank you to the committee staff and my colleagues who worked tirelessly to put this legislation together. This is important legislation. It addresses a number of issues that we've been speaking about in this committee: rapid consolidation in our healthcare system, competition among healthcare providers, and improving price transparency for patients so that they can access clear and comprehensive information to compare costs, evaluate options, and ultimately make informed decisions about their health and financial well-being. I appreciate the committee working with me to recognize providers that experience greater challenges, like those in health professional shortage areas, and allowing them more time to financially prepare for changes to their reimbursement rates for drugs administered in Medicare Part B. I certainly support policies that ensure Medicare patients benefit regardless of the providers that they see. And in many cases, this will lower copay for our constituents. I also believe it is important to reinvest some of the savings that result from the policies being considered here today in a targeted way that shore up hospitals facing financial challenges and those that care for a substantial number of low-income patients. I'm also very pleased to see legislation that I introduced with Congressman Brad Wenstrup, Protecting Patients from Middlemen Act, included in this package. Our legislation would prohibit prescription drug plans and PBMs and Medicare Part D or Medicare Advantage from charging patients more in drug cost sharing than the net price of a drug. This is a common sense patient protection that will ensure that PBMs are not forcing patients to pay more for their medicine than what they negotiated in their coverage. As we continue to address vertical consolidation in the PBM space, I also want to encourage my colleagues to support legislation my colleague Buddy Carter and I introduced, Protecting Patients Against the PBM Abuses Act. Our proposal will help to correct these perverse issues and bring relief to patients by ensuring PBMs are not compensated for putting the highest priced drugs on formulary. 3 PBMs control 80% of all prescriptions managed in the U.S. They own and are owned by insurers and have vertically consolidated to own everything, including doctors, pharmacies, and rebate aggregators. Congress must also end this conflict of interest. If you are a PBM, then you be a PBM. But PBM should not be allowed to be the insurance company and the pharmacy too, because they're profiting by dictating to their small mom and pop competitors how much they can be reimbursed for dispensing medication, and they also profit by making sure that patients pay more. I look forward to working with the committee on legislation focused on the anti-competitive practices of these middlemen and breaking the link between drug list prices, rebates, and PBM compensation. Thank you, and I yield back.